Are you a pharmacist? And absolutely have to know how the prescription will be written and how we have to find the errors and how to rectify it and how to dispense and label the prescription, right? So here I have a detailed explanation in this video. So you're watching Pharm D where learning is made simple, easy and fun. First you have to know what is prescription is. So prescription, the pre means before and scripts means writing. So before writing, that is the Latin word derived. So, prescription is written by a registered medical practitioner or a licensed practitioner, then like a dentist, veterinarian, or more on. And then you receive a pharmacist. As a pharmacist, you receive the script, prescriptions, and you will dispense and label the compounds present in that, and you will be giving to the patients. So, you are the final product of prescription. So starting will be the dentist or veterinarian will start that, and you will be the final one to dispense that. So what are the parts of prescription is? The prescription should contain name, detail of the patient, superscription, inscription or epigraph is it, or subscription, renewal instruction, signature, and also signature of the prescriber. If there is a missing of a signature of a prescriber, you should return to the patient and get the signature, and then only you can do this. So first one is the date. So date is the very important thing, you should note that, because as the prescription may contain a narcotic drugs like addictive drugs, so you should check these all the details, and then when does the drug has been dispensed or when does the prescription has been written, this you should be mentioned there, or else as a pharmacist you are not allowed to make any prescription prescribed medicine there. So next one is the name, age, weight of the patients. So as a prescriber you should note this, because the age is a very important factor. As for the children, the medicine will be varying, so you should be note down these things, or else you have been mistaken the medicine, you will be catched by the police. So as a pharmacist, note the age and weight of the patient and prescribed dose of the patients, and you should check each and every medicine prescribed to them, then only you should dispense and label the medicine. So next one is the superscription. So it always mentioned as RS. So as you go into hospitals, they usually see the receipts of the doctors. You can see the symbol RX there. That symbol is called superscription. So it means in olden days they considered it as a god of Jupiter, who is the god of healing. So they usually mention the symbol. As days pass, it become a symbol for the writing of the medicines. And also it is mean as you take these medicines or take there. So this is what the main thing that RX means. Okay. So next is the inscription. So you should note one thing in inscription, that is inscription is a very important, that consists the name of the medicine and the dose of the medicines. So for example, I'm giving paracetamol. So if there is written 500 mg, you should note the age of the patients, and then you should be consider that correct weight and the age of the people equally calculated, and then should be rechecking that, and then only you can dispense that. So this inscription is an important thing. In olden days, this inscription is very important, because inscription consists of three parts: base, adjustment and vehicle, which means base is the basic medicaments which should be present in the medicines, and the adjustment, if any ingredients should be added, and then vehicle to make up the volume. This is what done in the olden days, because if you go on into olden days movies or somewhere else, you can see the hospital usually take a powder and just mix with the other powders and just fold it in a paper and give it to. So this is what the important thing they have done there. So nowadays inscription is not like that. Just we can write paracetamol 500 mg as pattern 250, anything else. So you can just take the tablets from the shelf and just cut it down how much pieces and just give it on. So but the olden days, this part is an important part too. And next one is the subscription. So first one is the superscription and this is subscription. Don't get confused with this. Superscription is the RX symbol and subscription is means that the medicine's direction and the pharmacist how much time it should be taken, the dose, the prescriber's instructions will be written here. So that you can easily understand the perfect way of cutting the medicines or how much tablets of paracetamol should be given. These all the things will be mentioned in the subscription. And next one is the signature. So this signature is not like signing or whatever the thing is. So this consists of the patient's regarding time of administration. So which time the patient will take the medicines or which time it should be done. In olden days, they usually write this type of thing: Cogila magnum tor indi pas bibus subnidama, which means to make the patient heal faster or if any cancer or uncurable disease has become, they usually write this because to make them more motivated to get fast recovery. So this was the important thing they have followed in before days. This will contain the quantity of the taken or amount of the used medicines, the frequency or timing of administration or application, the route of administration, and the special instructions such as dilution direction will be all written in the signature part. It's not a sign, it just consists of these are the things: how much dose, time of administration, and how many days. These all the details will be given in the signature. Next one is the signature of the prescriber and the seal something else, the hospital details will be written on this seventh part. So actually before that we usually write this renewal instructions. So renewal instruction means the prescriber should indicate how much time this medicine should be repeated. If any narcotic drugs are there, how much time it should be repeated, or else it will have an habit for the patients to be taking and misusing the medicine, right? So it should be written, and these are the things you should note while you are getting a prescriptions. And so these are the things just I have given you example. So then how to handle the prescription? You may have a doubt, right? So let me explain you. To handle the prescription, we have four parts. First one is the receiving, reading and checking, collecting and weighting the material, compounding, packing and labeling. So while you're handling a prescription, you will be sitting in a separate cabin, right? The patient will give you a letter or a prescription to you. So while you're receiving the prescription, you should not show any sign like by seeing the prescription, you should not show like this person have cancer, right? Like a reaction. That should not be given here, because you should not show any particular thing to the patient as a pharmacist. So you should be very noted that these are the things. Next one is the reading and checking. As I already told you, the reading and checking is an important thing because the prescription may contain some narcotic drugs. The patient may misuse that to get the narcotic drugs. So you should be very careful at the point of view. Next is the collecting and weighting the material. You should collect the material and kept at your left side of the shelf. That is, you should take the medicine from the shelf and keep at the left side, and then middle you should keep a weight machine, and then at the right side the weighted thing should be placed. For example, I'm taking paracetamol from the shelf, so I'm just place it on the left side, and then take 250 or 50 mg in the weight machine, weight it properly and place it at your right side. So this is what the perfect thing, and after completing that, just place the particular medicine as the place where it is. Okay, this thing should be noted. Next, compounding, packing and labeling. As you know, as a pharmacist, your main duty to compounding, packing and labeling, right? So you just compound it, like you should fold the paper, or if it is a tablet, you should just fold it in a paper like a envelope or something else if you can make it, or what the thing you have learned in the lab you can do here. And then if it's a syrup, you should be placed in a bottle. So these are the things should be named, and the name of the medicine should be noted there, the time of administration, storage, and then the direction of the prescribed medicine should be written in that label. So nowadays this was like a machine work. So like you will go to a doctor's, and then the doctor will write a prescription, then you will get the prescription, and you will do the medicaments, and then you will pack it, and you will send to an you will send the prescription, the price of the prescription to the PPA, that is the hospital receptionist. Here they will make the rupees and detailed information about that, and they will return to you. You will dispense the medicine and give to the patients, and you will tell the patient to take that medicines. So this is what nowadays it was repeating. So the first thing is we should note these are the things, but if there is something else you should note particularly, you may have a doubt, right? So this is called posology. The patient's main details will be your sign. So the posology should be maintained here. The posology means, it is a Greek word that means how much or how much amount you should be giving to a patient. So as a pharmacist, you should know what are the things should be administered by the people at this age, or what are the things should not be administered by these peoples. So these are the things should be noted by you, so that this will be mainly dealt by the pharmacist. As the doctor, they will simply write it, the rectifying the error will be done by you. So that be called as posology. So what are the things you should know? The first thing, age and sex, body weight, route of administration, time of administration, environment factors, physiological factors or physiological state, pathological state, accumulation, drug interaction, idiosyncrasy, genetic disease, tolerance. These are the things you should be noted while you are giving the medicine, because these are the things are main to noted, because patients will be administered overdose and they may get any sickness, they will be pointed by you, because you the people want to check that, right? So you will be punished there. So as you get the prescription, these are the things should be checked there. The first factor is the age. So each age people have each type of medicine. The one type of medicine which you give to an adult will not be said for a child or an old age people, because the child does not have a developed system for administering that medicines, or if you give an overdose, the child may die due to that. And also you may have heard a news in the newspapers, right? Administrating the dolo, the child has been dead. This is due to overdose of medicines. So as a pharmacist, it is your purpose or your responsibility to be noted that. So next one is the sex. So sex is like, it may be vary for male and female, and also the puberty female, and also pregnancy female. So the female have many type, right? So the woman male, and then pregnancy woman, then puberty people. So these are the things should be noted, because some medicine will cause a side effects while you're administrating at the particular time, like pregnancy or puberty. So this medicine should be noted down, and then as a pharmacist, you should return to the doctor or a prescriber who has written that, and then you should correct that medicines according to their sex, so that only the prescription consists of its sex, age, and name of the patients. And also you will be noted that another factor, that is body weight, right? So body weight is an important factor to calculate the medicine's weight. So according to your body weight, if there is over fat or over slim, the medicine should be equally calculated according to your body weight. So normal weight or normal height will not be affect the medicine anymore. But if the patient is over slim or over fat, so you should know these facts according to that. And also the route of administration. Some medicine should be administered at the night times, so that the medicine can take the effective effects on that your body. And some medicine need the day times, so the circulating systems will be administered or just admired on that process. Some medicine should be given as IV. So these are the things should be noted in the prescriptions. And next is the time of administration. So this consists of if the stomach is empty, the medicine will be faster and absorbed faster, and it will give the effect more faster, right? So these are the things that will be giving equivalent like drugs action will be noted in this. So if some drugs are causing irritation, then it should be given after the meal. If some drugs are causing some uh, allergy or something else, it should be administered after the meal. So or it should be done with some of the incompatibility errors, so this should be overcome, so that we use this time of administration in the prescription, noted point in the prescription. Next one is the environmental factor. So some medicine may need some environmental factors like it is extremely cold. If you take Canada, some medicine cannot be transported from other states, it should be made from there. So till now Canada is having some dispensing pharmacies there, so you should dispense the pharmacies things there. So like environmental factors will be against that, so it should be maintained. So some medicine cannot be done with a daylight, so it should be done in night. So these all the things should be noted, and some medicine should be administered at night because it has sedatory effects. So these all the things should be noted in the prescriptions, and you should write in the directions to and tell the patients about this. So some medicine may have the emotional factors, like patients may lose their very loving one, and they may feel for their lifelong. So in that situation, so you should give some lactose or dextrose, that is just for their conveniency, not a medicine, just for their conveniency. So for the mental health, we usually give this lactose and dextrose because it does not have any medicative effects. Even though the patient's conveniency, we do this. Or some patients are mostly in the like any mental hospitals or mental health hospitals. You can see this dextrose and lactose in done or bulk, because these are the things which are administered by the patients just for their convenience. So you should see the physiological state of the patients to write the prescription. Next one is the pathological state. Pathological means it's nothing but disease. If someone has some disease and they got cold, so for example in a kidney disease, the excretion of drug will be very tough or reduced, so that you should give the drugs in according to their health. So for example phenolbarbitone can be administered, or aminoglucosides can be administered. So if some patients have gastrointestinal disease, so they have a achloric acid, that is reduced HCl production in the body, so the absorption of drug will be reduced. So according to their own body's things, it can be administered. Next one is the accumulation. So some drug cannot be absorbed by the body at the particular time, so it will take prolonged time for the absorption. For example, prolonged use of chloroquine causes damage to retina. So you should be note this narcotic drugs and their side effects too while you're writing the prescriptions. Next one, the drug interaction. So drug interaction will consist of synergics and antagonism. Synergism is means that two drugs that enhance to increase the action. Antagonism is just opposite to that. Two drugs are used which oppose one drug's actions. So this is what the synergism and antagonism which should be noted while you are prescribing the medicines, because synergism will enhance the actions, like you can use paracetamol and aspartame while you are doing a surgery. A mild analgesic can be used then. And then procaine and adrenaline can be combined to increase the action of procaine. So these are the things can be help, and also it opposite. So opposition, like any poisons, like milk of magnesia is an acid poisoning, but if it is given with the milk, it cause an acid to your cause acid poisoning to your body. So just note down these things while you're writing the prescription. Next one is the idiosyncrasy. So idiosyncrasy is the if someone has the snake bite, so you will give a medicine to them, so which should be opposing the action, right? So this is an exceptional response to a drug in few individual patients. For example, some patients have aspirin, maybe asthma, penicillin. This may cause to their allergy to their skin, so this should be noted, that is allergic reaction to their body. So in certain situation we cannot note this, like I have told snake poisoning. So other than that, we can note the medicine's effectiveness. Next is the genetic disease. So genetic disease like any AIDS or any HIV, which is found just passed from the elders. So this can be noted because these things will make cause their lifespan full of diseases. So just note down these things like family histories, right? You should note down these things and just give the medicines to them. And some drugs may form the tolerance to their body, like natural tolerance, aqua tolerance, cross tolerance, tachyphysia, and drug resistance. So these tolerance can be done because, for example, natural tolerance. This will cause an race or inherently less sensitive to some drugs. And aqua tolerance means repeated use of a drug in an individual for a long time causes a large dose to produce the same effects. So, if a patient is taking paracetamol for a long time and again they get fever, you are giving again a paracetamol, it not works in their body because they are taking paracetamol, their body has produced an antibody against them, so it does not work on them. So it should be changed. So next, cross tolerance. This can be done by any pharmaceutical development against the related drugs like alcohols or relatively more tolerance to sedative drugs. Okay, so these can be done. Next, tachyphysia means fast protection, that is a rapid development for the tolerance. When a dose or drug is administered repeatedly, they will form a fast tolerance to that, that is called tachyphysia. Then this can be example like epinephrine, nicotine, etc. Next one is the drug resistance. So some drugs have the resistance to themselves, like a microorganism which is having the like Staphylococcus, which has the resistance to penicillin. So if you're giving penicillin to Staphylococcus, it does not take it because it has the resistance to that. So some antimicrobials have their own resistance to other things. So this or the things can be noted in the prescription for a long time. So now you get how can we correct this. So this correcting of this mirror error is called as incompatibility. So incompatibility means the mixing of two or more antagonist substances and an undesirable product is formed by this is called as incompatibility. So that we call this incompatibility is should be corrected at a particular time, or else when the patients administrate that they may get some disease or something else. So this should be corrected particularly. So this incompatibility is actually three types: physical, chemical, and therapeutics. That one thing that related to our prescription is called therapeutics. So therapeutics is error which is made in the prescription, which may result of prescribing a certain drug to a patient within the intention to produce a specific degree of pharmaceutical action, but the nature or intensity of the action is just reduced and differ from the intent by the prescriber. So these are nearly five types, that is error in dosage, wrong drug or dosage form, counterindicative drugs, synergisms and antagonist drugs, drug interactions. So first one is the error in dosage form. Many therapeutic incompatibility result from error in writing or interpreting the prescription order. The most serious type of dosage error in the dispensing is overdose of a medicament. So it becomes a duty for the pharmacist to check the prescription before dispensing it. So pharmacist the main position in detecting this. For example, let me say the preparation of 10 capsules of aspirin. So we take an atropine sulfate, phenobarbital, and aspirin. The main dosage form will be very error in this type of therapeutic. So you should check it and just give back to the prescriber and tell them to correct the overdose of atropine sulfate and then return back to you. So or else we can make there will be a error in the direction of prescribing. So this should be corrected. Next is the wrong drug or dosage form. So they maybe have a wrong spelling. For example, if you take a prescription, on seeing that you will be noting that the prescription writing will cannot be understand. The first letter only be seen, next will not be seen, right? So actually it have a Latin term for each and every medicines. So for example, prednisone is written as prednisolone, or a dioxin is written as dioxinin, which have a different effect on medicine. So you should return back to the prescriber and just correct it and then dispense it. So this may have some error in the drug or dosage form, route of administration, what are the things present in the prescriptions. Next is the counter-indicative drugs. This counter-indicative drugs may be vasoconstrictors, or the drugs may be a penicillin which is allergic to the patients, or any corticosteroids or allergic to the ulcer patients. So this should be corrected as to return to the prescriber. So you don't have any rights to correct that within yourself. After you're discussing with the prescriber only, you have the perfect duty to correct that, because the prescriber may give that intentionally to make the patients to administrate that and get the more effect, but he may not know, it may have incompatibility like this. So you should inform to him, and if he told that to be a correct method or something else you want to do it, or intentionally or unintentionally they have done it, just correct it by yourself, like adding, if it is an expensive powder, you can use can separate the powder like oxidative and reductive and just give to the patients. Okay, so but nowadays it's not like that, you just take the medicine and give to them. But you should note this thing like tablets, it should be noted. Next is the synergist and antagonism drugs. So I have already told paracetamol and aspirin, when they combine to form an analgesic action. So this can be used. And antagonisms, like some drugs may oppose the actions. So if they have some poisoning to oppose that, they can use this. Or if they are using acetyl salicylic acid and probenzene acid, it may neutralize the effects. So it should be changed by the prescriber. Next one is the drug interactions. The drug interaction, one drug may opposes or simultaneously have the same action as the another drug, should be given to the prescriber and change it, or else you should consult the doctor for this purpose. So these are the things you should be noted while you're writing the prescription. As a pharmacist, you have an important duty in noting the prescription's way of writing, and how you should know how to handle the prescription, and you should also know what are the incompatibility present in the drugs, or what are the things you should know, like posologies, the how much it should be taken, how much science it is there. So you should be noted all this thing for prescribing a medicine. So I think you have understand clearly how to write a prescription. So once again I'm saying prescription is a very important thing that should be noted by you, because as a doctor they may have written the medicine in a, because they have seen more patients, right? So they may get confused and write the medicine wrongly. So it's not a purposely have done. So you have to correct that and just inform the prescriber about this, and then you should dispense the particular medicines. So always note that you are a pharmacist, so you have more responsibility than the doctor. So just consider the medicines as a consider the patient's life as your life, and just give the medicines to them. So I think you have understand this section clearly. So see you in my next video. Bye bye, see you later.